Hi, everyone.
Hello.
Hello.
Hello, good morning.
Hi there.
Hi.
Good
Just
morning.
letting everybody in the meeting. We'll get started in a couple minutes. Hi, everyone. I'll get started in just a couple of minutes. I'm letting a few more people in.
Sounds good. Thank you.
Hi, Tom.
Hi there. How's everybody doing?
Great. We have about 20 people on and more joining, so I'm going to mute you all until we start our conversation.
Hi there.
Hi, John.
Good morning.
Just letting a few more people in. We'll get started in just a couple of minutes. If you don't mind muting until we get started, that would be great, everybody. Hi, everyone. Just letting a few more people in, and then we'll get started. Hi, Chris.
Morning, Libby.
Hi, everyone. We'll just give it 2 more minutes. I see a few more people coming in, so I'm going to mute everybody until we get started talking, since we have about 30 people on the call.
Hi.
Hello.
Hi, this is Emily from United Health Centers.
Hi, Emily. We'll get started in just a couple of minutes. We have a few more people joining.
Hi, this is B from United Health Centers.
Hi, B. We'll get started in just a couple of minutes. We have about 30 or more people on the call, so we're going to mute everyone for a moment until we get started. Okay, I think we have a good number of the folks we expected to join us, so I think we can get started just momentarily here. Just a few more people joining in, and then we will get ourselves started. Thank you, everyone, for your patience. I'm so happy to have more than 30 people on our call today, and we'll do introductions momentarily. I think we have the majority of the folks we expected to join, so without further ado, we'll get ourselves kicked off. My name's Libby Sagara. I'm with Blue Path Health, and I support the eConsult work group some of you have heard of, and I'm providing project management for this Fresno eConsult countywide effort. So excited to have you all on this call today. It's surprising in a good way to have a date work for everybody, and of course, we would be much more pleased if we could meet in person. It's hard when we're doing this by phone. We do want to make this interactive. We do want to hear from you. So if you do want to pipe in, feel free to unmute yourself, because we have 30 or more people on. I've muted you all. You can also use the chat feature if you have questions as we walk through our conversation. But there are points that we will ask you for your input. So we really do hope to make this a candid and interactive session. I'll just quickly go through our agenda, and I'm going to hand off to you all to speak. I'm not going to talk the whole time here, but we'll spend a few minutes just on introductions, making sure that we know who's on the call today. We have such a great group from across the county. And we'll spend a little bit of time going over our goals and objectives of this countywide program, our approach, and the milestones, what we hope to accomplish throughout the next few months. and then spend the majority of our time talking about how we can get you all involved in making this the best possible collaboration. So getting providers engaged from all of your organizations, and obviously we have great payer support and association support from many who are on the call today. I'm letting a few more people in. Sorry for the delay here. We also do want to get your input on measures of success. How do we look at eConsult, and how do we see it as being a productive resource in terms of increasing access to care for patients across Fresno County? And we want to look at what we can do as a group. So hopefully meet on a monthly basis, talk about what we can accomplish together as part of this countywide collaboration. As I've mentioned, I have you all on mute. Please feel free to take yourselves off mute if you'd like to pitch in and make any comments here. But for now, I'm going to take a moment here and do a little round robin of introductions. And because we do have so many people on the call today, I'll call you out. If you don't mind unmuting yourself and announcing your role quickly, that would be great. Just if you could name your organization and role, that'd be very helpful. So I'll start out with provider organizations. Do we have Camarena Health on the call today?
Yes, my name is Lenore Seiler, and I'm the Chief Compliance and Quality Officer.
Thank you, Lenore. Anyone else from Camarena?
Yeah, Dr. Ramirez, I'm the Chief Medical Officer for Camarena Health.
Thanks, Dr. Ramirez. Clinica Sierra Vista?
Hello, this is Nancy Bañuelos.
Hi, Nancy. Thank you so much for joining.
You're welcome.
A Community Regional Medical Center. I think we have you all on. Make sure you unmute yourself if you'd like to introduce. And we will come back to you. Family Healthcare Network. I think we're on. Matt, are you on? I know we have Matt Miller on, so he might be on mute. Okay, Omni Family Health.
Good morning. This is Cindy Stewart. I'm the Director of Managed Care.
Thank you, Cindy. Do we have anyone else from Omni on?
I don't believe so.
Okay, thanks. And I know we had United B, I think you're on.
Yeah, Beatrice Perez from Clinical Service Officer for United Health Centers.
Thanks so much. And I know that Valley Health is also on. Valley Health, would you mind introducing yourselves? Okay, I think we have someone from Valley Health, so thank you so much for joining us. I believe, is it Sean?
Can we,
Libby, I'm here. I didn't do the dual unmute. I unmuted one line, not both.
No,
Sean Fowler, Valley Health Team Chief Information Officer.
thank you.
can we have Emily go ahead and introduce herself too?
Yes. Emily?
Emily.
Hold on, unmute. Hi, happy Friday. I'm Emily Morales. I'm the Central Referral Department Manager.
Thank you, Emily. Thanks so much. Okay, we're going to move on to our IPAs and networks. Do we have CCIPA on? Okay, I know we have Central Valley Health Network on. Mary, are you there?
Yes, Mary Renner, Chief Operations Officer with Central Valley Health Network.
Thanks, Mary. Do we have any other CVH on?
Yes, Jason Vega, CEO for Central Valley Health Network.
Thank you, Jason. First Choice Babylon?
Hi, everyone. This is Dr. Marcus Zachary with Babylon.
Thank you, Dr. Zachary. I think we have others from your group on too.
Yeah, hi everybody. This is Chris McCrary, Executive Director with Babylon First Choice.
Thank you, Chris.
And Nicole.
Nicole.
Hi everyone, Nicole Howard. I'm with First Choice Babylon as well.
Thank you, Nicole. Okay, moving on to LaSalle. LaSalle, do we have you on? We'll come back to you. I think we have you on, but you might be unmuting yourselves. Sante? Okay, we'll come back. I know we have some representatives who might be on mute. Okay, we're going to move on to health plans. And Joel, would you mind introducing yourself?
Yeah, hi everybody. Joel Gray, Executive Director with Anthem Blue Cross's Medicaid Health Plan. And I have several different responsibilities, but for today's call, a lot of focus on provider partnerships and our telehealth and digital strategies. So really excited to be here, and thanks everybody for joining.
Thank you, Joel. CalViva. Oh, I'm sorry. I'm going too fast. Tom and Greg, 1 second. I'm sorry. We need to introduce the rest of the Anthem team that we have on. Tom, would you like to introduce yourself?
Sure, no problem. Hi, everybody. Tom Manning, Planning and Performance Director with Anthem, and I work on a lot of our strategic initiatives, telehealth initiatives. So it's great to be here. Look forward to working with everybody.
Thanks, Tom. Karina, are you on?
Yes. Good morning, everyone. Hi, my name is Karina Mendoza, and I'm a provider rep with Anthem Blue Cross.
Thanks, Karina. Mohit? I believe we have Mohit on too.
Yes. Hi, everyone. Sorry, this is Mohit Ghosh, Anthem GR, and very excited to be here to learn more about how this is all going to play out. Thank you.
Thank you, Mohit. Do we have any other Anthem representatives on?
Yes, this is Blanca Kinnenmore with Anthem Network Relations.
Thank you, Blanca.
Good morning, Janet Payne with Anthem's County Account Management Team. Good to see familiar faces and hear familiar voices.
Thanks, Janet.
Hi, Libby. This is Lynette with Provider Relations.
Hi, Lynette. Thank you. Okay, I don't want to miss
anyone. Good morning. This is Tanya Gonzalez, part of the Provider Relations Department in Central Valley.
Thanks, Tanya. Okay, I think we're going to move on to CalViva. Greg, I cut you off earlier. Greg, would you mind introducing yourself?
That's okay. Good morning. This is Greg Hunt. I'm the CEO of CalViva Health.
Thank you, Greg. Jeff, are you on?
Yes, I'm here. Good morning, everyone. My name is Jeffrey Nkanza, and I'm the COO at CalViva Health.
Thank you, Jeffrey. Do we have any other CalViva representatives on? Okay, I'm going to move on to Abby. I saw you pop into your head, Abby from HealthNet.
Hey, Libby, it's Abby Totten. I'm the Medic Health Program Officer for HealthNet.
Thank you. Dee Dee, are you on? I know we have Dee Dee on. She might be on mute.
I am. I'm sorry. Dee Dee Iverson, Vice President of Operations for our HealthNet Medi-Cal line of business.
Thank you, Dee Dee. Mark, are you on?
Hi, I am. Good morning, everybody. It's Mark Schwer. I'm the Director of Telehealth Programs for the California markets for HealthNet and California Health and Wellness.
Thanks, Mark. Do we have any other HealthNet representatives on?
Hi, this is Marianne Souza. I'm the Telehealth Services Manager for HealthNet and CHW.
Thanks so much, Marianne. Any other HealthNet or CalViva that I missed? All right, thank you. And I appreciate everyone's patience. I'm so excited that we have so many people on, and I think it's important that we all hear the voices that we would otherwise know if we were all in the same room together. So now we're going to talk to our project team and those who are working as part of the effort, and I'll go over to ConfirmMed, our e-consult platform and service provider. Dr. Anderson, are you on, Darren?
Yep, I am. Hi, Libby. Hi, everybody. Nice to see a lot of familiar faces. I'm Darren Anderson. I'm the director of the Weitzman Institute and the president and executive director for ConfirmMed.
Thank you. Augie, are you on?
Yes. Hi, Libby. Good morning, everyone. I'm Aggie Erickson. I'm Director of Business and Partnership Development.
Thanks, Aggie. And I think Marianne is on too.
I am. Thanks, Libby. Marianne McGuire. I'm Head of Strategy and overseeing the Fresno Collaborative from the ConfirmMed side. Nice to meet you all again.
Thanks, Marianne. And I mentioned I'm with Blue Path Health, and we have others from Blue Path on. Timmy, Leslie, would you like to introduce yourself?
Hi, everyone. It's Timmy Leslie, and I'm the president of Blue Path Health, and really happy to be here. It's making me smile. If you could see my body language to see all of you here. This is great.
Thanks, Timmy. And John, are you on?
Yes, good morning. John Weir, consultant with Blue Path Health. Nice to meet you all.
Thanks so much, John. And if I've missed anyone as part of our introductions, please do feel free to pipe in either through chat or you may take yourself off mute and introduce yourself. I don't mean to skip anyone, and I'm so pleased that we have so many people on our call today. It's just, it's a great testament to everyone's commitment to this project. I also want to note that we do have Chris Perrone from California Health Foundation on. Chris, would you mind introducing yourself? Chris, you might be on mute.
It said I could take myself off mute if I just pressed my space bar, but that didn't work. So good morning, everybody. Thanks for letting me join. Chris Perrone, Director of Improving Access at the California Healthcare Foundation.
Thank you so much, Chris. And with that, I think we can move on to what we've been waiting for after our round of introductions. Thanks everyone for your patience. And it's great to hear all your voices and meet you and at least see your faces, since we've had a chance to talk to so many of you on the phone. And those who we haven't connected with on phone will be following up over the next couple of weeks to get your input and reactions to today's conversation. So with that, I think, Timmy, I think I'm going to hand it off to you to talk about today's objectives.
Yes. Hi, everyone. So we have, I think, an hour and 15 minutes with you today to really kick off this work. And as Libby said, I think she's had several conversations with many of you to set the stage. So I just will roll right into what our objectives are for today. We are hopeful that we'll be able to establish a commitment with those of you that are here today to be able to go forward with realizing the goals of the project. And we'll be, drafting many of those, or at least confirming those with you today. In addition to that, we really want to get your insight to how we might be able to think about, either editing what we're putting forward in front of you as a straw person, or are there areas that we need to prioritize or double down on? So, as interactive and as much as we can to be able to pull that from the conversation today, we look forward to doing so. Also, just as we went through the introductions, many of you may be thinking about folks that you'd like to be able to pull into the conversation, whether it's from your organization or partners of your organization, or other provider groups that we may have missed. Or other key stakeholders. And if that's the case, please let us know. Let's go ahead and use the chat for that as well. So if there are stakeholders you'd like us to be able to include going forward, let's make sure that we identify them. We are, as Libby went through our agenda today, we're going to hear a little bit from all of you who have had some experience, whether provider or payer, with eConsult. And we want to think through how we might be able to help to prioritize the onboarding of eConsult throughout the county. And I can't emphasize enough as we go through projects like this, how important it is to be able to identify those provider champions that will not only be able to be kind of shoulder to shoulder, if we could be shoulder to shoulder, or hand hold, but to be able to address questions and help to lead the charge with either difficult conversations that may need to be had or really easy conversations, but those that we can point to that can help to be able to identify any potential roadblocks and be able to get through them. And we'll be looking for those provider champions either through today's conversation or as a follow-up. And then finally, we have at least blocked a good portion, and Libby and I will hopefully make sure that we stick to our agenda. We do want to be able to hear from you. What would success be for this collaboration over the next 3, 6, 12 months? And so hopefully you can start thinking about that now, and we'll be pulling that through. And again, as interactive as possible, and if we can use chat, let's use it. And try to be able to kind of draw your thinking out that way. If we could be in a room together and have a whiteboard, I'd be at it right now with lots of different pens. So hopefully we can appreciate that we're doing our best kicking this off virtually. And as I said earlier, just as I made my introduction, BluePath has been working in the space with eConsult for the last 5 years, and we'll go ahead and put it in the chat. We have the eConsult work group that includes many of you as leaders and other stakeholders across the state and now the country, coming together to share successes around eConsult and really bringing together research and case studies and best practices. And we help to disseminate that through our website, as well as monthly webinars where authors of the latest research and those that want to be able to kind of talk about some of those best practices are able to do so. And we welcome you to join that overall work group. But it's been probably about 2 years now, we've recognized the need to be able to be very provider-centric with eConsult adoption and ensure that payers are coming together and also those that the payers delegate to be able to support eConsult so that the provider can use eConsult, integrate it across their practice in a standard way and know that that benefit is available across their panel of patients. And that kept really zeroed in on us last year at our annual meeting. And Anthem approached us in, I think, May of timeframe, Joel, to think about where and how we could pull together the necessary stakeholders and do that type of a program or project across a community. And here we are. So that's, again, why, if you could see the body language, we are thrilled to be able to kick this off today. So Libby, do you want to add there? Is there anything that I missed?
No, I think you covered it, Timmy. I think you touched upon some of the key tenets of our project here that I think we've made so much progress over the past couple of weeks, just making brief contact with you all, but that's why we're here today, is to focus in on these key themes here.
So I'll go ahead and give you an overview of the slide again, where and how we can take your input and iterate to be able to reflect your thinking. We will do so, whether it's here verbally or through chat or through follow-up. But I'll just go ahead and introduce this. The vision is for us to be able to really transform access to specialty care through eConsult. And I know that for many of us, we've been focused on that access to care. But what we also want to do with the combination of our efforts is to be able to incorporate eConsult as acknowledgement of a first step towards a routine, non-urgent specialty referral. And doing that, what we're hoping to do is be able to, look at that specialty visit as it should be, and that the specialists are able to practice at the highest level of their care and do with the highest acuity of patients. And I think in order to be able to bring that vision to bear, we're hoping that this project will kind of work against 3 really key principles, and that is to collaborate with either existing eConsult programs, make sure that any existing eConsult program is being highlighted, and we are able to work with providers that are currently engaged in an eConsult program so that they're maximizing their effort, that they're able to block and tackle any issues that they might have, and use this collaboration to have those communication lines that may have been missing before. And be very vendor agnostic. So whichever vendor or other EHR solution that they might be using, that we would embrace that as part of this project. The other key tenet is to implement new platforms if need be. And our partner here with ConfirMed, that has a relationship with both Anthem as well as HealthNet and Calviva, I think are really ready to go and to be able to slot in any gaps for a new eConsult program. Again, if a provider would like to adopt a new, a different platform other than ConfirMed, they can go ahead and do that as well, and we will support them. And then finally, to be able to identify if there are needs to align payment for eConsult. Are there patients that may be that may not be available to that benefit? How do we engage with that payer that may not be at the table here today? And then also to think about whether or not there needs to be additional incentives, and what are those incentives, and how to align those incentives across payers and also those delegated groups. I think at the end, we really want to, at the end, when we see the end, we would like to be able to see, this type of approach work towards sustainability of eConsult, and that it is incorporated as a standard referral practice, and that we all have the same understanding of its benefits, and that we're holding ourselves to a standard, and we're able to evaluate and be able to, have the evidence base to support the key benefit of eConsult. And I'll stop there and ask for questions. And Libby, I'll rely on you too to see what I've missed.
And that was great. And please feel free to take yourself off mute for a moment if you have any comments. If you are on mute and you'd rather chat, that's fine too.
Joel, I'll lean on you, or Abby.
Yeah, no, I can definitely chime in a little bit here. What really caught my attention here for Anthem Blue Cross is looking a little bit at Inland Empire, and I know we have some slides on that later, and we might get to that and talk about that. But eConsults, the more I've read about them and heard from providers and seen some areas that have done them in Los Angeles and in the Bay, and just how big of a deal they are. I think there's even an article online that says, "Can eConsult save Medicaid?" We all know how difficult specialty access is and the challenges, and it just feels like the more I've researched it, that eConsults really are a strong benefit to some of the challenges I think that are more acute in Medicaid than, say, commercial and Medicare. So we started looking into how could we get to this transformative vision that's up on the screen right now, and really quickly realized it really had to be a coalition. It had to be all the stakeholders across an entire county or delivery system has to come together and agree to it. And looking at Inland Empire, they developed an eConsult coalition. So we reached out to Blue Path as kind of a neutral third party and said, hey, how do we replicate that across different counties in California that Anthem operates in? And Blue Path was gracious enough to take this project on. I mean, they're very mission driven around this, really impressed by all the work they've done at the state level, even at the federal level. And so they've kind of brought us all here together to say, can we execute on such a vision across all of Fresno, the whole Medicaid delivery system in Fresno, to have this kind of eConsult first approach. And so really appreciate that everyone's engaged. Calviva, I know you guys are here as well, and HealthNet, and of course all the provider partners on the call today. So that's just my initial thoughts, and definitely we want to do everything we can to partner and see this through.
Yeah, and for HealthNet, I mean, we've been very long supportive of the eConsult model, and what we're really interested in is how do we best support integration at the practice level to improve physician satisfaction. I mean, I think the fundamental issue is we're not growing more physicians, and so we're going to have to take the time and effort to really work through how do we make the best use of everyone's time, and especially on thin margins as we move through the state budget crisis and more people are moved into the Medicaid system. And so we're really excited to just have the opportunity to work through with all of the constituents who are impacted by this type of model, as opposed to doing it from the top down, because we've really, in our experience, what we found is the most important aspect of a successful eConsult program is having physician leadership that not only believes in but espouses the value of eConsult. And so it's really through the partnership of all of the organizations here that we're going to make something like this successful, as opposed to us as a health plan telling folks what we want them to do. So we're really excited to see everybody at the table, and we've worked with Timmy and the team for a long time, so excited to see what we can really produce out of this work.
Thank you so much, Abby.
Greg.
Yeah, go ahead, Greg.
Go ahead. Yeah, I was just going to say that I think, we've been supportive of this for several years now, and the inroads have been pretty slow and kind of shallow. So most interested in looking at how we can identify barriers and eliminate them, and really get this to be a platform that everybody can use. And I think now that we're in the pandemic and patients are more accustomed to this kind of encounter, it makes their primary care physician more amenable to, I think, this kind of a solution for specialty referrals. So we're very encouraged that we're all getting together and look forward to working with everyone.
Thank you so much, Greg.
Great. Yeah, and I think my only last comments are just hearing Abby talk. This is a very rewarding moment for me where we get to kind of put our competition aside. And I keep hearing this word what is it, Timmy? Cooperation or
cooperation? I think you coined it, yes.
Yeah, so I really love that because, we're coming to you as the health plans in Fresno for Medicaid and saying, we're putting that aside. We really are here to do what's the right thing and work with our, all the provider stakeholders on this call so that when you look at launching e-consults, it's you don't have to worry so much about, is it going to work different with Anthem than say CalViva or HealthNet and so on. So that's just really exciting to be able to come to the table with that approach.
And I think what's really different too about this approach is the engagement of those the delegated entities too, the IPAs and medical groups. And, that's always been an area where when we work with Medi-Cal managed care plans that they tend to roll out e-consult directly with their direct contracted providers. And then there's this kind of, I don't want to call it a black hole, but there's this this gray area. And then how then do you kind of go through the delegation hoops to be able to include and make sure that the access to e-consult is there. And so that's something that I think we're also very pleased to see those of you that are here today to really lean in and kind of figure out how we're going to be able to, again, identify what those barriers may be, Greg, and, put them up on the wall and block and tackle them, which is, I think, what we're really hopeful to do as we work with the rollout. Libby, do you want to go to the next slide?
Yes, go ahead.
So this is a very, it's amazing how fast and how quickly we've been able to move through this work. We believe it or not, kicked this off mid-October. But you'll see a kickoff as the 1st of October. BluePath was able to do a little bit of groundwork and planning while we were waiting for the go sign. But here we are mid-November and we have all of you at the table. So I think, kudos to Libby, who you've been doing such a great job of being able to do that outreach and answer folks' questions and be able to get you all calendared here today before the holidays. But we are not going to let our foot off the gas. We're going to continue to move as quickly as possible to get as much progress as possible through the end of the year. And then we will take stock at, what does the rollout look like in 2021 and what roles do we all play? But between now and the end of the year, we're really hoping to identify, at least a few provider groups, provider clinics that will be able to, raise their hand and be part of this project formally and, really work to roll out e-consult, whether it's, in the calendar year or early next year. But you can see our key milestones here. We do have conducting a landscape assessment, and that's been partially the work that Libby's been doing with her team, working and reaching out to all of you and getting an understanding of what type of experience base you have with e-consult or where you've had some opportunities to be able to expand and who are your partners to be able to make that happen. And that's will be a compendium of data for all of us that we can use as we move forward. We also been working to have, the stakeholders that are here at the table and the commitment to this work. And we are planning to have these monthly roundtables that'll get much more, sharing progress. What are some of the big issues? Definitely more rolling up our sleeves and working together to be able to, think about what communications gaps need to be filled, as implementation gaps that need to be filled, and also to be able to measure our progress. So I think we have it at the very end of the meeting. I think even Libby, you can put it in the chat. We have our next roundtable already scheduled for December, right?
Well, we're looking to pin it down with you all, make sure that it works for calendars on December 15th.
So we'll send that timing over to you. But again, we want to keep this momentum going, and we'll have another roundtable in December. And then as we move forward, we would expect that we would have these monthly gatherings, and then have, of course, much more touch points that would be with partners and with individual organizations. Libby, I'll let you take this one.
Sure. I think we've touched upon this a bit as part of the timeline that Timmy just reviewed with you all, and looking at what we want to accomplish in a very short turnaround. Having reached out to many of you, I think you understand many of these components of our effort, and we just wanted to give a quick view of what we hope that the payers who are on our call today are contributing to the effort, and also what we would hope providers can do as part of this project. So together, as part of our landscape assessment, we're looking at specialty access needs across the county, what is scarce, what could be offered through either a local or remote specialty panel. We are hoping, and we know that our payers are willing to support e-consults for all of their Medi-Cal plan members. And we know that this is, as Timmy mentioned, a platform agnostic program. So we know some of you clinics may already be up and running on a certain platform. We know ConfirmMed is here to support those who have not gotten up and running yet, and we know it's a quick and seamless and painless process to get up and running. We do have that support from ConfirmMed and their years and years of expertise. So we'll talk a little bit about that later on today. We and ConfirmMed, and working with the payer and provider organizations, want to be able to get the word out to clearly communicate to your provider users, the primary care providers who will be sending the electronic consults. And we want to be able to provide tools to engage them and get them up and running as seamlessly as possible. In order to do that, as you would guess, it's very helpful to have a champion, and having that provider champion at the table with us, both on the primary care side and the specialty care side, is so important. Having that advocate and that proponent of using eConsult, the actual provider user who can walk the walk, is so important. So we hope that we can work with you today to be able to identify those champions. We want to hear from you as part of the interviews that we've been doing with many of your organizations. What support is needed for primary care providers to do and participate in eConsults? What incentives are needed? What time, what support is necessary to facilitate participation? And you've already checked off this locked box as participating in our roundtables, and we hope to have just this much or this level of participation ongoing every month. Any questions or comments just on our components of our program, or anyone have anything to add there? Okay, I think we've covered this, so let's get into the more interesting stuff here. I'm going to put, I'm not going to put him on the spot. I did ask Matt Miller to say a few words. It's great to see that we've had some FQs who've already had experience in doing eConsults. A number of you are familiar with this. You may already be participating, whether it be in Fresno or in other counties. So I'm going to ask Matt to take yourself off mute, Matt, and share a little bit about your experience to date with eConsult from Family Healthcare Network. Matt, go ahead.
Hi, good morning, everyone. Can everyone hear me? I had some issues with unmuting earlier. Am I coming through okay?
Matt. You're great.
Okay, great. Thank you. Here at Family Healthcare Network, we've moved into the eConsult platform going on, I'd just say a little over half a year, 8 to about 8 months at this point. A lot of the things that have been discussed, I keep hearing the term collaboration, and that definitely has been something we've experienced as a result of rolling the eConsult platform out in Tulare County, primarily where most of our health centers are located. Just sharing some of the feedback as far as how that process has gone for us. For sure, we've seen improved turnarounds on specialist referrals that previously, without the eConsult platform, we experienced a lot of excessive wait times. I'm sure a lot can relate on the phone here from the provider side in terms of the limited specialist resources. There's a lot of wait times that patients are having to face. So the eConsult platform has really helped streamline a lot of that and allow us to have much quicker turnarounds on some of these specialty consults that we've been in need of. And in turn, obviously has improved the patient experience quite a bit as they are getting the care they need in a much more timely and efficient manner. One of the things we've also found is it's allowed us to avoid unnecessary face-to-face appointments that again could oftentimes waste the patient's time and energy and efforts in terms of having to go out to a specialist only to find that that appointment wasn't necessarily needed and they're routed back to the primary care. So the eConsult platform has really helped us to streamline that process in terms of making sure that we're really only referring out to specialists those types of needs that require the in-person consultation versus something that could be handled through the PCP. And then, as I mentioned, it's really changed our approach in terms of collaboration with PCPs and the specialists. The eConsult platform is much more supportive of these specialists referring or providing their expertise back to our primary care providers so that they can address the needs of the patient versus that disconnect that sometimes can happen once we refer a patient out to a specialist and we're either waiting for a consult to come back or it doesn't make its way to us. The eConsult platform has really helped hone that in and make sure that we're getting the information needed from those specialists that are supporting us. That on the surface has really been most of our initial feedback. Obviously, there will be impacts financially as we're able to streamline the referral process with specialty care in this area. It's a little bit too early to tell to really show the impacts of that, but I'm sure we're going to see it as time continues and we continue to get the buy-in of all of our PCPs across our network of health centers. So that's kind of been our initial experience, and we're excited to expand into Fresno County with this as well.
Thank you so much, Matt. And I'm going to pause for a moment in case anyone has questions for Matt. You can feel free to unmute yourself and ask a question or use the chat if you wish. And I just want to stop and highlight. Oh, go ahead.
No, this is Abby. So Matt, what do you see as of all the specialists that you're using through eConsult, what do you think has been the most valuable specialty access that you're bringing in?
You know, that's a good question. There's been a number of specialties. The main pain points that we've felt that we've really placed focus on. I know rheumatology is something that immediately comes to mind. I unfortunately couldn't give you a definitive answer at this moment, but I know there's been some concentrated specialists that we've been working on, and I'd be happy to go into more depth with that as soon as I'm able to compile that information for sure.
Thanks.
Any other questions for Matt?
I have a question. What about your providers? How did they feel when they utilize your specialty services? I mean, what was their comment? I mean, did they feel that it was worth, referring to the specialty and having that one-to-one with a specialist?
So, with any changes always can be difficult, as I'm sure everyone can relate to. But as soon as our providers could see the turnaround that they would get in utilizing the eConsult versus having to wait for the traditional specialist, patient to be seen, there was a definite buy-in from their side. They've been very receptive to the process. The fact that we get a physical consultation back in such a consistent manner and in a quick manner, they saw the value pretty quickly, and that it's been a generally positive experience for our providers as a result of that.
Great.
Matt, I have a question for you. So how did that workflow look like at Family Care Health Network? Did the PCP initiate it to go to for an eConsult, or did it go to the referrals department and they sent it from there? How did that look like? How did you?
So we within our organization, we have a dedicated referral team. So anytime PCP determines the need for a specialist, it gets routed into our centralized referral teams. They will make a determination based on the need that the provider is wanting them to be referred to, whether or not it's warranted for an e-consult or not. That's definitely one of the learning curves that we dealt with initially, was making sure that we're properly evaluating what it makes sense for an e-consult versus what is ultimately going to become a face-to-face appointment as it is. There's no sense in utilizing the e-consult if we know it's going to automatically convert to some sort of face-to-face encounter, and vice versa. We want to also readily identify those things that definitely are a proper candidate for being an e-consult, and then we avoid the process of putting them out to a face-to-face specialist when not warranted. So it's kind of a collaborative effort between our referral team and the referring provider to make that determination.
And so would once the referral clerk makes that determination, like if this is a good specialty or referral that could go back to e-consult, would they advise a provider that's going to go to the e-consult?
Yes, the referral processing is a collaborative process with the referring provider. So we certainly would communicate to them that it's being submitted in the e-consult format. Generally, we're keeping the PCP abreast of the referral process in and of itself, so they're aware of what direction we're going and what their expectations should be in terms of what they'll receive back for the consult once completed.
Thank you so much, Matt. And I think it's really interesting you pointed out, and we should reiterate in case any of you are new to eConsult, that eConsult is meant for routine and non-urgent requests. So those requests that need immediate attention from a provider are not necessarily appropriate for eConsult. So we're talking about routine, non-urgent. And then I want to point out, Dr. Anderson from ConfirmMed shared that Family Healthcare Network's top referrals specialties are GI, neurology, cardiology, ortho, and urology. And Matt, I might have cut you off. Go ahead.
Matt, this is Cindy. I have a question. So have you experienced yet a patient who's had an e-consult with ConfirmMed, and that patient then going to a specialist in the community, and what the reaction was from the specialist? Were they satisfied that the patient was worked up more thoroughly before they were presented to the specialist office in the community?
Yes, actually, I was when I was probing for some information from our team, one of the referral reps on our end actually had shared a story very similar to that, where we routed the patient through the e-consult process initially. Because of the workup that came from that, we were able to more successfully set them up with the actual face-to-face encounter. And because of the efficiency in the e-consult and the quick turnaround, they were seen in a much quicker manner, and it eliminated some of the back and forth that sometimes can happen when you have that initial consult in person, and then it goes back to the PCP, and then it moves from there. So we did get some positive feedback even from the patient experience in terms of the timeliness of this process and making it more efficient once they were actually seen by the specialist in person.
That's great.
This is sort of the dream group, I have to say. Everyone is actually participating when you could hide on video, but people are speaking up. So thank you so much, everybody. Any other questions for Matt?
This is Jeffrey. I think I have a follow-up question that's kind of related to what Cindy just asked, more in the sense that from a patient perspective, once they've been able to get something resolved through e-consult, have you ever had any experiences where the patient would have actually still wanted to have a face-to-face encounter, but it got resolved through e-consult and it wasn't needed? And therefore, I guess, did they get a complaint, or was there concern about that?
You know, I haven't heard or have had any specific examples shared with me in that kind of outcome, but certainly I could see that being a scenario that could present itself. But I think in most instances, especially with the populations that we're serving out there, when we can turn something around as efficiently as we have been able to, they're usually much more willing to take that approach, even if it is in a virtual environment. Certainly, the current COVID pandemic has made it much more agreeable for folks in terms of doing these kind of virtual-based encounters instead of being in person, just because of the general concerns that a lot of folks have maybe with doing those in-person visits. So definitely being in this kind of environment where we're doing a lot of virtual type based visits, there seems to be a lot more buy-in on the part of the patients to be willing to accommodate this type of platform.
Thanks, Matt. And in response to Jeffrey, we have a slide coming up just reminding us that we need to keep the patient or the member at the center of this. And we don't want to lose sight of that as we talk a lot about provider engagement, that patient satisfaction, member satisfaction is also so important and at the core of our work here. There was a recent publication that I'll share with you all that came out earlier this year specific to eConsult and patient member satisfaction. So I'll share that following our call today. And with that, we're going to go a little bit more into some of the same themes Matt's speaking to here on our next slide. And Matt, I encourage you to pipe in as we talk about some of these factors in terms of engagement. And Timmy, I welcome you to speak up here, but I mentioned the research that comes out of San Francisco. We have Dr. Anderson and team who've published so much after a decade or more of work in eConsult. So there is a wealth of resources out there around projects that have been implemented. And we wanted to talk to you a little bit about what we are asking of this group. So we touched upon this earlier as part of our project roles, but we, as part of our roundtables, would like to make sure that we have, and we can see that we already have engaged leadership. We want to work with your established relationships, and that's what we're doing in understanding better the landscape of Fresno County. We know that ConfirmEd makes sure that the technology is intuitive, and of course, if you're already up and running on another platform, you have already tackled that challenge of making sure that your providers understand the technology, because it's not a technology related, it's not a technology, the technology is not the top priority, it is the workflow and making this easy for your providers. We are helping with the project management effort, and we know that our payer group at the table here is covering the cost of the project for you all. And we, as part of our roundtables, want to be able to tackle those challenges. And Matt, you mentioned, and I know Greg mentioned earlier, let's talk about some of the barriers. Let's make sure that in our roundtables we're identifying what those barriers are and what's specific to Fresno. We know that this is not top of mind for everyone. We're in the middle of a pandemic. We understand timing is not necessarily on our side when providers, especially in primary care and the FQ settings, are very much overwhelmed right now. So we understand that we want to be able to provide something that is going to reduce burden on PCPs. So we understand that. We know that there are a lot of questions around integration. We're not going to be able to tackle those on today's call, but we do encourage our follow-up conversations to be able to discuss any integration questions or challenges that you have. And there are a lot of questions around liability, and we want to emphasize that with eConsult, the patient relationship resides or is kept with the primary care provider. So if you have additional questions around that, we've had a few really great presentations as part of our eConsult work group recently, and we can share those examples with you. But we know across California, one of our biggest complaints over the past few years has been a lack of reimbursement for eConsults. And we're lucky with Medi-Cal having recently acknowledged that eConsult is reimbursable for specialists. We do now have a CPT code for eConsult, so we're beginning to be able to tackle that challenge, but we understand there still needs to be acknowledgement of primary care providers' time. And I'm just looking at our comments here. Because we have so many people on our call, Joel mentioned, if you don't mind noting who's speaking, so if you want to pipe in, if you could just say your name and your organization, that would be really helpful. I'm going to ask Timmy, do you have anything you wanted to add to this?
I think it was great. It's just guiding. I am very thankful that we have the field level of experience that can pull these learnings together in one slide, and that we have these kind of guardrails as we move forward. And we'll probably continue to be able to add to this as we move forward, but it's a great starting point. And we know that represents, months, if not years of work.
I do want to mention that our advisor, her name is Dr. Delphine Tuo. She is at SF General. She's the clinical advisor to the eConsult work group, and she's the one who came up with these ideas as a nephrologist herself. So moving on, just continuing on with these themes, just back to the patient perspective. We want to make sure that we are acknowledging that eConsult telehealth do not solve all problems in terms of patient access. We know that this is an ongoing concern, especially in California, especially during the pandemic. We had a great presentation recently from Dr. Denise Payan, who is a telehealth expert out of UC Merced, who really just got us back and focused on how eConsult can address equity issues, but we still do need to remain focused on the fact that patients need to understand what eConsult does. They need to be have an explanation of what has happened behind the scenes. Often they don't know any consults happened. So we need to remind them of how eConsult is a component of their care. So this is a great little diagram. I'm not going to read it to you all because you can see it on the page here, but this is out of the Association of American Medical Colleges. Whoops, went too fast. Just talks about how between a PCP and a specialist, that loop needs to be closed with the patient. I think, Matt, you alluded to that earlier. We need to make sure the patient understands what communications have happened so that they understand and trust the process. There are often language barriers to being able to explain what an eConsult is. So that's what we're here to help with, is making sure that this is understandable by the patient and that they feel like they're part of this decision-making process. And I know, Jeffrey, you mentioned that too. You did mention, what if the patient does want to be seen in person? We need to acknowledge that that is also a patient right. So we won't lose sight of that. That'll be part of our ongoing conversations and supporting communication between the patient and the provider. Any comments? I know you're all in the provider setting and I'm not, so I welcome you to speak up here.
Yeah, Libby, this is Matt again with Family Healthcare Network. So I did just want to comment on that piece too. You know, while we've certainly put into place certain workflows and processes by which we make those determinations as to, you know, what makes sense for an eConsult, we do always have to maintain a certain level of flexibility in terms of what the patient's needs are and what the provider's input as well. So while we may have some clear-cut criteria that we follow in terms of making that determination if an eConsult is appropriate versus a face-to-face, we do also have to, you know, keep into consideration those other factors, such as the needs of the patient, if they are insistent on wanting to see a specialist face-to-face, and also obviously the input of the PCP in terms of what makes sense to them. So while we have the criteria in place, it does act as more of a guideline, and we do have to, you know, have some flexibility there in making determinations as to which direction to move in as we process those referrals.
Thanks, Matt. Well said. Any questions or comments from Matt before we move on? And thank you for your candid feedback on your program, Matt. Really, really helpful for us all. We do want to just quickly highlight some of the activity that's happening across the state. And Timmy, I'm going to let you talk a little bit about what we've seen happen over the past few years.
Hi, so I'm back. So I guess this is just our portion of the day to let you know that you're not alone, although I think the fact that we are all together kind of looking at this as a countywide initiative makes it something special. But there are several programs that we can rely on and learn from across the state that have been sponsored by, mostly have been sponsored by payers, whether they're an initiative or they are, individual programs. And also, what we like to do is to be able to draw the circle around what we're doing here, which is combining the payer initiatives across to be able to solve the different issues that might arise. I think that's really what we wanted to emphasize here. And then we can drill down on a few of the additional payer programs. Any questions here?
We've seen this slide grow and grow over the past 5 years, which is really exciting. It started out as just a few programs across the state, and now it's not just in California, but across the country. So we're excited to see this grow. We want to highlight a couple of data points, and Dr. Anderson, I know a good amount of your data is here, so we want to give you hats off to ConfirmMed and Weitzman Institute, who's a great contributor, but go ahead, Timmy.
So I think you all are, are already believers of eConsult, but this is a good reference point. And it was, and we've pulled these different key pieces for us to be able to kind of use as a way to evaluate, and are we going to get these benefits out of the program or the project. We typically look at the specialist response time, and what we see, and I think ConfirmEd, you hold yourselves to within at least 24 hours, that the response time for eConsults will generally come back from a half day to 3 business days. And in fact, I'll throw out there, and I think you'll see this later on, one of the key measures out of the PRIME program for health systems was holding themselves to an interaction with the specialist and the PCP within 5 days, and that we're really starting to see the needle move to most of those that are participating in the PRIME program have been able to do just that. We also are looking at, are we able to reduce unnecessary face-to-face visits? And I think Libby and I are continuously amazed when we look at what the metrics are, or the metrics and the outcomes that we're seeing across different programs. When we started this work 5 years ago, one of the papers I think was done by Robert Wood Johnson, one of the only ones that was out there, they looked at, and they were basing on the reduced face-to-face visits around 25%. And we're seeing upwards of 50% in most specialties. So, I think, again, we can set our bar pretty high here, but we expect and anticipate to see at least over 25% of reduced face-to-face visits. And the other key piece that we're seeing in programs, I think, are particularly important, and may be important to this program as we go into your particular needs, are the number of no-shows that are being reduced because of the use of eConsult. And Matt, I don't know if that's something that you've been tracking, but we are seeing that when a patient is able to receive that eConsult, that they then have perhaps the necessary workup, and that they are more able to be able to make it to that appointment, or if eConsult is not being used, that you typically see more no-shows in an appointment schedule because the patient may not have really needed to see the specialist, and that just gets bared out over time. And then we go to satisfaction, and we've already talked about that, around PCP satisfaction, specialist satisfaction, that we can clearly measure, but also, as Libby presented, that we need to make sure that we're looking at the patient experience as well, and looking at equity and access with the patient view. So those are really the key measures that I think will hopefully draw into how we measure our success. Are there others that you all would like to see? And maybe we can talk about it now, but continue the conversation over the course of the rest of the meeting.
And Timmy, I'm going to pipe in Dr. Anderson, who's the source of a few of these data points. Go ahead, Darren.
Thanks. Yeah, no, I just wanted to make one comment, just one cautionary comment about the face-to-face reduction stat. When you look at all the different eConsult research, there's a tendency to blend all of them together. And yet there's 2 very distinct models that get very different outcomes in this specific regard. If you do like LA Cares or Inland Empire, where you make it a mandatory first pass, you have to do an eConsult in order to get a referral, this number is much lower. In fact, Inland Empire just presented their results this week on Monday, and they showed a 15% reduction in unnecessary face-to-face, but that's because it seems they're using it more or less like a prior auth kind of a thing, and all consults for the most part are going first pass. And if you look at the data from LA Cares, if I remember, it's somewhere around 25 or 30% reduction. But if you, and I don't think it's a coincidence that the satisfaction scores tend to be lower. Providers don't like it when they're forced to do an eConsult first, no matter what. The other group of research, the research that we've put forward, is in scenarios where it's not mandatory, where it's voluntary. It may be facilitated, but voluntary, and that's like what Partners is doing, that's like the research we've done and other programs, and then you're more likely to get numbers in the 75, even 80% range sometimes. And so I think you have to look at two different types of implementation models when you look at these numbers. And I think 75, even 80% is very realistic. And that's roughly what we've been seeing at Family Healthcare Network in Camarena.
And I'll just kind of throw in the tidbit too from our meeting on Monday, where we highlighted the experience base at the VA. And at the VA, I don't think, Darren, that it's required, but it's definitely available to their providers. But I was just blown away by one of the clinicians who's working on eConsult, that she found when she was working with one of her specialists, that she was able to help their specialists move, it was 60 to 80% of their current panel of patients back to primary care, because they were doing more routine care that could be taken care of at the PCP. So it was just really moved me that there's a lot of work to do, and that that eConsult can be a tool that is not only just helping with that provider to provider communication, but hopefully, making some real impact on the specialty on the availability of specialists in the region in general.
The VA is an example of a really, really mature program. I worked at the VA when I was a resident in the 90s, and they didn't call it eConsult, they just called it normal business. This is just the way primary care and specialty work, and it didn't even have a name at the time.
Yeah, and I think it's interesting, Darren, you might have said this in the past too, that patients may not understand that this is an eConsult either. They might just think this is what their doctors do. so that might be something we think about when we're explaining to this to patients, that your doctors are going to talk to each other and decide the best way to take care of you and your concerns. So great point. Joel, did you have something to say?
Yeah, I'm just thinking as we get to this slide and thinking about how much time's left, I'm also just wondering if any of this is kind of resonating, or any thoughts, comments so far from the provider organizations on the call, from our FQHC partners to our IPAs. I think it's usually when stuff like this is up on the screen that I hear the most questions and feedback around, do some doctors have concern about taking feedback from a doctor they don't know, and getting questions answered to do treatment, that kind of stuff. But yeah, I would just love to hear from, either leaders at, Clinica, Omni, United, Camarena, I think we have on here, and some others, or again, any of the IPAs, kind of, how is this resonating with you at this point as we go through the deck?
Well, I'll chime in for Camarena. I'll tell you that it's resonating very well because we're already partnered with ConfirmMed. We've been with them for greater than a year now, and I'm happy to provide kind of the perspective on our implementation and how things have been going for anybody who's interested. I'll include my email, or I don't know if you guys have access to the email from the invitation, but happy to provide that for anybody who's interested. The way we've set ourselves up is we've set for eConsult to be a default process. We wanted to make it as easy as possible for the process to take place. And so the provider actually has to deselect the option for it not to go as an eConsult. When we were introduced to eConsult, we absolutely loved the idea of having eConsults in place. The way I view it is sort of as a curbside, right? For the medical providers on the call, we always went into the curbside. We'd be on inpatient rounds and we'd say, well, let's go hear what Reno has to say, right? So this is, for me, how I view it. This is just getting kind of a curbside consult. Our referral team will validate the insurance just to make sure. So even though it goes as a defaulted eConsult, the referral team just make sure that the health plan is partnered up with it. And then one of the things I enjoy about it is we get a monthly report on our utilization. And that's something that I look at every month. And I'd like to see sort of just the trajectory, and also where we're sending a lot of eConsults. Because that for me just triggers an idea for maybe we need to get some more education in this area. If we're sending a lot to room and it happens to be certain diagnoses, well, then maybe we need to have someone come in and do a talk or a workshop presentation on this condition. I also like it because I think it really helps to broaden the scope for our PCPs. I think what happens is when we graduate from our medical training, that's probably the most informed we're ever going to be, the most knowledgeable we're ever going to be, because as time passes, you sort of just kind of get narrowed more and more into what your scope is, and you become familiar with certain conditions, familiar with certain medications, and you start to forget or become less comfortable with managing those other types of things that we learned in medical school and residency. But this ability to do the e-consult and get those report back, and I gotta tell you, those reports that come back, it's almost like going to UpToDate and doing a search on UpToDate and getting that whole report back. So it's very, very informative. It's really, really amazing. They should be giving CME credits for it. It's just really helpful. And so I think it's helping for my providers to really, again, broaden their scope to get a little more comfortable again with managing some of those other types of conditions. So for me, that was a selling point when I introduced it to the medical providers, was saying, look, we know we're struggling with getting access to certain specialties. Here's an opportunity to get something that will come back really fast. In most instances, we're getting reports within 48 to 72 hours. So you get an answer really quickly without having to wait weeks or months for that patient to get an appointment with a specialist. That leads to less frustration for the providers, because they're often very frustrated about the amount of time it takes to go and see a specialist. And it's also less frustration for the patients who's waiting to get that appointment, right? So now as a provider, I can tell a patient, look, I can get an answer, at least something to get the ball rolling on what needs to happen, what's the next step for us in about 2 to 3 days. You know, and then from there, we'll see what's the next step, whether that's scheduling an in-person appointment or starting a medication or ordering a certain test or an imaging study. And so patients really appreciate that as well. One of the things that I really like, and then I'll kind of stop, is they're rolling out a new ability for there to be communication that takes place between the PCP and the specialist. That was a question I had when we first were kind of launching this internally. We would get the specialty report back, but it was a little bit of a challenge to be able to, if we had a follow-up question, ask that question of the specialist. Well, now they're working on something that will be able to have that communication take place in case there is just like a quick little follow-up. It doesn't require a whole new referral or any of that. We're able to have that communication in place. One more thing. They do offer lunchtime workshops as well. And those lunchtime workshops are really helpful. In fact, they encourage for participating organizations to present cases in those workshops so that there can be collaborative learning that takes place among all of the participating organizations. So that's myself for ConfirmMed. I promise they're not paying me for any of it. I just really have enjoyed working with them. It's been a good experience.
Wow, Dr. Ramirez, I'm frantically taking notes of all the things that we need to remember as best practices. So thank you so much. Any other questions or comments on data or experiences today?
Yeah, so Libby, I'd be curious, Dr. Ramirez, we've been really happy at HealthNet to be able to support all the work you guys have been doing, and I've been really impressed with, the continued commitment of all of our provider partners who worked with us to implement. I'd be curious to hear your perspective on, where you see e-consult going into the future, and if you think that current volumes will just continue to rise, especially given the pandemic environment.
Absolutely, I think so. I think that, I think it was Matt or someone said earlier, introducing something new, there's always a little bit of some hesitance to accept change, right? I think that's a natural process, but over time, what our providers see, and I think that there's some data that supports that was included, over time, what providers find is it is an opportunity to not only get specialty input, but also get more speedier kind of information, and also get patients access to specialty care in a more timely manner. So it's just, I think it's gonna continue to evolve, and I don't see it going away, especially as we're seeing now with COVID. Pre-COVID, we weren't doing any virtual telehealth visits, and now, there's a significant amount of visits taking place telehealth. And so I think it's just adopting new technology, and I don't see it going away. I see it growing. We are adding as many specialties as we can to ConfirmMed, again, because of what the value that we see that it provides.
That's great. Thank you.
Well, I welcome additional input and questions through our chat. We're going to move on just to keep us on our schedule here, and we appreciate everyone giving us an hour and a half, but keep the questions flowing. we want to give a couple of different examples of programs that we've seen across the state. I'm going to make this brief just for sake of time. Joel, you mentioned Inland Empire's program earlier. We just wanted to give a quick highlight, and this goes back to Dr. Anderson's point on volume and the sort of the required first step to a referral that Inland Empire has placed as part of the program. So in a year and a half of doing e-consults, they've seen high volume. They've spread quickly across 2 counties to 93 sites. They offer 44 specialties. And they've engaged a huge number of providers, as you can see here, around 300,000 lives as part of their program. And you can see how the volume has changed over the past year. So e-consult has continued through the pandemic. It's provided a way for primary care to connect to specialty care, especially when patients had, for a certain amount of time, were having a hard time getting in to have face-to-face visits. So they've seen great volume over the past couple of years and are really helpful in terms of providing examples to us all. I'm going to go to our next slide quickly to keep us on track here, and just want to provide another example of partnership health plan. I think this is a nice example of how e-consults break down in terms of what happens once an e-consult is sent. So this quick little pie chart here shows that 54% of the e-consults sent as part of the program, patients' needs were addressed without having another follow-up conversation. You can tell here there's a small percent of consults that are requested that end up being for a different specialty. Some are sent requiring additional diagnostics or medications. And then you can see here that only 28% of these were referred for a face-to-face visit. And another great data point is that the patient time to care went down from an average of 51 days to now 4 days for the patient's needs to be addressed. And you have a great coverage area across your county, a large geographic area. Partnership health plan spanning the state reduced their patients' travel costs significantly, 25% of costs of traditional out-of-area specialty services, and a huge reduction in patient travel time. So they're just, this is a great patient-focused program, and they have thought as part of the pandemic and trying to provide that continuity of care for their patients. Rather than going straight to a face-to-face referral as a result of an e-consult, they have put into their program a component of e-consult then to live video as a next step. So it's a great example of incorporating sort of a telehealth flow. Any comments or questions on these 2 examples?
I think Libby, oh, go ahead, Abby.
No, I just had a question. Have you guys ever looked at lining up the specialists that are used across all the e-consult programs to determine kind of what's the best bang for your buck? So if you can't get access to the whole plethora of specialists, is there something that is more, that gets more out of the physician's time from a specific subset of the specialists? I'm just curious.
So are you talking about perhaps those specialties that are optimized or that are most effective for e-consult? I think Dr. Anderson would say that every specialty can be conducted via an e-consult, but there are those that are higher volume, and I think we sent that via the chat. And I think any clinician would say that there are specialties that are more conducive to a face-to-face visit, those that are high touch, physical touch, that is. But we do have some data on that, Abby, that we can share as part of perhaps maybe our next webinar could be looking at efficacy of certain specialties. And there's some great data out of LA on which specialties have greater resolution of without a face-to-face visit as compared to others. So we can share some of that data as part of our next call. Go ahead, Derek.
And just really quickly, Libby, I guess there's 2 different ways to look at it. If it's network adequacy and access, it's going to be dermatology, rheumatology, neurology, the ones that are harder to get. But interestingly, in some of the cost data that we analyzed, if you're looking to generate savings, it's actually the procedure-intensive specialties like orthopedics and cardiology that are the most valuable, because even though you may send a smaller percentage of your consults and you may have less access issues, those are the ones that tend to generate the most savings when you prevent an unnecessary face-to-face and prevent the exposure to unnecessary procedures and tests. So in terms of fiscal bang for buck, I would say orthopedics is probably the #1. They prevent more MRIs than any other specialty that are run. So it really kind of depends on the perspective you're looking at.
Thank you,
That's
Darren.
helpful.
And I just want to make sure that we do give a little bit of time to the program that we have represented as part of our call today. And we have Mark Schweier from California Health and Wellness HealthNet. Mark, and I know we're a bit short on time, but would you mind just briefly talking to what you saw as part of Chappaday's program? Go ahead, Mark. Mark, you might be on mute.
Yeah. Hey, Libby. Yeah, thanks for giving me an opportunity. So I just wanted to, let folks know here that the Chappaday we've got a very long-standing, very close relationship, and they were sort of one of the seminal clinics that we started e-consults in back in 2016. And they've really done a very, very nice job with medical management. They brought on, senior medical leaders that had influence. They brought it into kind of a quasi-mandatory, self-imposed strategy that if you wanted a referral, unless it met one of the exclusion criteria that we built in collaboration with ConfirmMed and Chappaday, it went over to e-consults. And if a provider didn't want to do an e-consult, and it didn't meet one of the exclusionary criteria, they had to meet with their CMO and explain why. So it was really, on that basis, I think it was very hardwired into what they're doing. So just to level set in terms of performance in terms of utilization numbers and members, there's about 3,800 of our members that are assigned to Chappaday. They've done 650 e-consults to date. Nearly 2/3 of those were closed as PCP recommendations, and 98.1% of them came back within 3 business days. So, happy to answer any questions about the experience there, or provide any additional insight or data that you need.
Thanks, Mark. Are there any questions for Mark? We welcome, go ahead.
Quick question, United Health Centers. So how did that provider accept that it was said that, basically, it was sent, the denied referral went to the his boss, basically, or CMO, whoever is reviewing the e-consults. Were they okay with that, or did they disliked it?
Yeah, it was that's a good question. So it was a close collaboration, between us, ConfirmMed, and Chappaday, where we met a number of times with the physician group. We did get some resistance along the way by a couple of providers, but some conversations with the CMO, that he was able to just really influence the way they were practicing and just really sell the need based on the fact that, like Abby had mentioned, we're not going to grow our own specialists in a special orchard somewhere. So we have what we have in terms of specialists, and they knew that the wait time was going to be long. So they had a collaboration and really just kind of a meeting of the minds of this is what's good for our members and our patients. And that really propelled and really influenced, the practice patterns.
One more question for the knowledge base, because I would think also, the more you communicate with a specialist for, follow-up care and treatment, the more knowledgeable you'll become in that specialty in medication management, or really, I would think they would really want to, use e-consult just for more knowledge.
Yeah, that's
mention anything to that effect?
Yeah, no, that's a very good point. And, I've often had the discussion with Dr. Anderson and his group. And, as he's fond of saying, is that we hope to put ourselves out of the e-consult business someday by providing, such great education. And we do, follow and track and trend numbers. And we're really want to look at the data a little bit more closely to see, is it really, after multiple years of this, is it really going to influence and really cut down on the required specialty referrals?
Okay.
So that's important data for us.
Thanks so much, Mark. And we welcome additional questions to come in for Mark. Go ahead and use the chat. And luckily we have Mark on our ongoing calls, and we're happy to act as a sort of a conduit and make sure we connect you all for ongoing conversations. So appreciate your input there, Mark.
Yeah, thank you.
Libby, this is Timmy. I think there are programs that have applied CME as part of an incentive for providers, and we can definitely look at that as something that could be scaled across this program or this project or initiative. And there's definitely some great work coming out of CHCN out of Alameda, where they'll tell you one of the very big benefits that they see coming out of their program is the provider education, and especially new providers that are on a practice. It's a great training tool to be able to help onboard them as the practice. So we can definitely dig into that more going forward. And Libby, I'll go ahead and take this. I think in order for us to think about wrapping up in next steps, one of the things that BluePath will put on our to-do is to be able to develop a straw person dashboard that we can put in place and start looking at where we can get the data to populate it, but have, where we can start every meeting with how we're doing and be able to track our progress going forward. And we put this one together just to kind of hopefully to have some discussion. I don't know if we're going to be able to get there in this call today, but we'll leave it with you to think about what is going to be most important for you, your organization, your leadership, to be able to say, at the end of going through this work, that it was worthwhile, that you want to continue it and grow it, and that if you have business or if you cross borders outside of Fresno, that you would bring it there too. So that's what we're kind of putting that lens on this as a place for us to start that measurement. We added HEDIS measures and CAP scores as a conversation for you to think about how we measure patient satisfaction, and perhaps there are some HEDIS measures that could be impacted by e-consults and that are also important for the Fresno area. And then we've had a lot of conversation about how do we kind of look at specialties or e-consults by specialty, and are there some specific specialties that we want to track, either because they are an area that we want to be able to see access to, or Abby, to your conversation earlier, is there some type of a more efficacy that we want to be able to pull out by specific specialists or specialty area. So I guess we'll just leave it there, that this is a starting point. I'll open it up if there's, if anybody has top of mind, something that you don't see here that you would like to see, and we'll continue to build it over time.
Thanks, Timmy. I think this is a great topic for our next roundtable. Since we didn't quite leave enough time to cover it, we do want to have a few points for us to cover quickly. Timmy, you alluded to the PRIME data, just showing how the mention that you had earlier that e-consult was incorporated into public hospitals' ability to resolve responses for advice within the 5 calendar days. So just a great data point here of how all of these academic medical centers across the state were able to report increased use and increased ability to meet this through e-consult. But
I think it was, academic, but also just public hospital systems. But we can apply it to, I would love to see the same growth and apply it to the participating provider organizations. So it's something for us to take a look at and how we can track over time.
And as I go, I think we're going to the last slide. As we kind of wrap up here, I know we got another one we want to talk about getting on the calendar here, but I kind of see this initial kickoff meeting as a bit of a pitch to the provider organizations on the call, and I still think there's some decisions that need to be made by all the organizations joining today about participating in this. I've heard some already have e-consult programs stood up, and this might just be an expansion across Fresno with alignment from the health plans and the IPAs. But for others that have joined the call, I think this would be brand new. I think United Health Centers, if I remember correctly, does not have any consults right now. I'm not sure. I don't think Clinica Sierra Vista So just, I think as soon as possible, we want to try to get an indication from leadership of the provider organizations of are you in? And start working on this execution project plan that was up at the beginning of the meeting. And so we know which provider organizations we're going to partner with to get this stood up.
Thanks, Joel. So please do reach out to us. You can reach directly to me and we can figure out what's needed specific to your provider organizations and implementation. So we have a few topics here for our next meeting, and we know that we'll spend some time on data and dashboard and reporting needs. We also do want to be able to provide communications tools that are helpful to you all, and we'll be working on those over the next couple of weeks. But Abby, Joel, Greg, any comments before we wrap up today?
Oh, this is Greg.
Really,
we've been working with the e-consults in our entire service area and Tulare County as well. So, it's already pushed out to counties other than Fresno. I just want to keep that in sight. Camarina is more of a recent adopter. Family Health Care Network has been doing it for some time. So just want to appreciate their efforts and know that it's a regional effort right now, at least in our perspective, and I can see it grow pretty easy throughout the state if we do it right.
Thanks so much, Greg. Abby?
yeah, I completely agree with Greg and just echo thanks for everybody who was available today on short notice and came to participate. It was just really nice to see everybody and talk.
Thank you, Abby. You have our contact information with questions and how we can help you move forward. And we will check your availability for our next meeting. The tentative date's on your screen here, and we look forward to talking to you in less than a month. Thanks everyone for your time today.
Thank you, everyone. Have a very happy Thanksgiving.
Thanks, everybody.
Thank you.
You too. Bye-bye.
Bye-bye.